Hello, I'm Fiona Kennedy, and here is my dog Rosie, who likes to do presentations, but she does like to do them sort of lying down. I want to tell you about PTSD and dissociation just for a very brief time. There are lots of dilemmas in working with PTSD and dissociation, partly because dissociation is pretty not well understood. And it's a shame, because dissociation, we find it almost everywhere. Dissociation, for me, is a process. It's a process where, instead of associating things, which would be the normal course of events, we go into shutdown. And this shutdown affects the way that we respond, especially to trauma. So if you think about nervous systems, the parasympathetic nervous system is responsible for calming things down and shutting things down. So when we're relaxed and calm and safe, the parasympathetic nervous system, the ventral vagus nerve, will be active and keeping us in that way. Then if we get scared and we need to get ready for fight or flight, the sympathetic nervous system comes in and causes us to have sweating, shaking, increased heart rate, getting ready, preparing the body for action. However, at a really high level of threat, especially when the person is helpless, it's not really evolutionarily sensible to do fight or flight. So when a mouse is cornered by a cat and can't get away, the mouse's blood pressure will drop, heart rate will drop, there'll be a big physical reaction. And we call this dissociation or freezing. And that's mediated again by the parasympathetic nervous system, by the dorsal vagus nerve, which actually causes this physical shutdown reaction, and all kinds of psychological issues like feeling that the world isn't real, or I'm not real, or I can't feel anything, or I'm in a fog. Also, dissociation affects the development of personality. So if we have repeated trauma in childhood and we have dissociative reactions all the way through, we can develop a different personality structure, which is usually labelled personality disorder, as we grow up. And that can work for us. It can mean, for example, that we can relate to a carer who's abusive when they're nice, and then switch to another self-state to respond to an abusive carer when that carer's nasty. So I can go to school as a child without worrying about what's going to happen when I go home with my abusive carer, because those two self-states are dissociated. So I think it's very important when we're working with trauma to consider, do we have what's labelled PTSD usually, which usually involves mostly fight or flight reactions, although I'm sure you know it does have a dissociative subtype, or are we working with freezing? And how does the dissociative shutdown processes affect fight or flight and freezing? The reason that this is important is because it makes a big difference as to how we're going to treat the client who's experiencing this. And the research shows that during the trauma, if you had fight or flight, post-traumatically you'll have the same thing. During the trauma, if you had shutdown, post-traumatically you'll have the same thing. So I hope I've stimulated your interest in thinking about the relationship between dissociation and what we label PTSD, and how these are all trauma reactions. And as therapists, we need to really do a bit more thinking and working out how we approach the treatment of people who come into our office. Thank you. Bye-bye.